I'm Dexter Voisin, Dean of the Mandel School of Applied Social Sciences, and I'm pleased to be with you here today for those of you who are in person, as well as those of you who are joining us by live stream. Now, I'm introducing to you our new Executive Director of First Year Cleveland, Ms. Angela Newman-White, and for some of you, I am reintroducing First Year Cleveland. Now, as many of you know, First Year Cleveland began as a public-private partnership in 2015 in response to the alarming spike in Black infant mortality rates. And we all know the statistics. Despite world-class healthcare facilities in Cuyahoga County, we have some of the most alarming Black infant mortality rates in the country. In fact, some developing countries have better infant mortality rate outcomes than Cuyahoga County, which is really very shocking. So in 2015, First Year Cleveland began as a public partnership at the School of Medicine. And while there, it achieved several important goals. It resulted in the Medicaid expansion for doula services and the nurse-family partnership, which is considered the gold standard for in-home parental care. Now, what is First Year Cleveland? It's a collective of academic, healthcare, philanthropic, and political leadership committed to racial justice in our community and to saving babies. It involves both head and heart. And Angela embodies both, and you'll get a chance in a few minutes to see what I mean by that. She embodies both head and heart. With its move to the Mandel School, it is poised to make an even greater impact, combating structural racism, storytelling with data, addressing the social determinants of health, and more importantly, lifting community voice and expertise. Now, I've had many conversations with Angela over the past few months, and she's reminded us all that no progress will be made without the community at the center of this work. So I want you to join me in welcoming Ms. Angela Newman-White.
Thank you. This never gets easy for me. I promise. I've been doing this for over 15 years, and it's just like the first time in front of a microphone. But thank you so much. I'm very grateful to have the opportunity to speak with everyone today about not only First Year Cleveland, but what's happening with infant mortality and our efforts to address it. So I'm just going to start by, talking about, the most exciting point in a family's life is, when they become pregnant and they're expecting a baby. And we all sort of search for that, that pie in the sky, the great outcome for our kids, but initially it's that first birthday, blowing out that first birthday candle. That's the goal for all of our families. But when we think about what the reality is, not only in our community, but across the country, some folks aren't celebrating first birthdays. They're headed to celebrate the life that they thought that they were going to have with their children. And an even harsher reality is that Black women are 3 times more likely to lose their baby than white women. Pregnancy is supposed to be the most transformative experience in a family's life, to bring life into this world. As women that are carrying babies, growing life inside of you can sometimes give you purpose, sometimes provide that extra motivation to not only change behaviors, but have a whole different outlook on your life. And so we as women do everything that we can to ensure that our children thrive. But for Black women in Cuyahoga County specifically, they're 3 times more likely not to be able to celebrate the birth of their baby. So my objectives today is to really talk about, what infant mortality looks like here locally and the impact of racism and the social determinants of health on birth outcomes. And of course, First Year Cleveland and our response. So just, some fact finding. So infant mortality, for those of you that don't know, it's the rate of deaths per 1,000 live births. And we use the denominator as the live births and the number of deaths in the calendar year as the numerator. And so thinking about it as a rate kind of demoralizes it and reduces it to a number. but it's actually often quoted as an indicator of the overall health of society. How just and fair are opportunities for families to thrive? Infant mortality is often used as a meter, and we are not doing well. Here's some data out of the Cleveland Department of Public Health and the Cuyahoga County Board of Health, some analysis that's done in 3-year increments. It's best to look at it on a 3-year average because that data is more reliable than just a 1 year. And so the point of this graph is just to show our overall trends, that we have seen some slight improvements since 2013. However, if you notice the line with the blue line with the blue circles, the white infant mortality rate of 4.2 is almost, so our black infant mortality rate landing at 13.4, we're talking about 3 times the rate of death. The county rate was 7.3 for that 3-year average. So black women are almost twice as likely to lose their baby than the average birth outcome in the county, but almost 3 times more likely than white women. And this is what we're trying to close the gap and reduce the infant mortality rate overall. Our Healthy People 2030 goal out of the CDC is really 5, and our white and Hispanic rates have surpassed that. And so we have to continue to do more work to support our families. The top 3 causes of infant death are prematurity, so babies born before 37 weeks, sleep-related deaths, and congenital abnormalities, which are birth defects. For the purposes of this conversation, I'll just be focusing on the top 2 because birth defects sometimes can't be prevented, and there could be something, with the development of the fetus that maybe an intervention was not accessible. Prematurity as a leading cause, and it's really babies born prior to 32 weeks gestation. And so the percentage of prematurity over the most recent data is 15.5% for black families, black women, and it's as low as 9.1% for white women. So that inequity right there is one of the leading drivers of the disparity in infant death that we see. And even though, prematurity is not always preventable, if you're at risk, there's some things that we can do to help to mitigate those risk factors. And those being if you've had a previous preterm birth. Some of the literature says being black puts you at risk of having a premature baby, which is, in my opinion, false. It's not being black that puts you at risk. It's being in an unjust, unfair, and racist society that puts you at risk if you aren't white. When we talk about the prevention strategies, the top 2 are related to clinical interventions. So for those of women that if they have shortened cervix or a previous preterm birth, there are some interventions that can be done to help carry the baby to term. But the bottom 3 bullets here talk about behaviors and overall community context. And so when you think about prevention, yes, we do want folks to have a healthy lifestyle and have a healthy diet and reduce stress. But let's think about what are the contributing factors to not eating healthy, to being stressed, and to being exposed to more opportunities or being driven to unhealthy behaviors. Very briefly, sleep-related deaths, of course, are 100% preventable. We talk a lot about the ABCs of safe sleep, alone on your back in a bare naked crib. We consistently support this messaging and provide this information to communities. However, between 2011 and 2020, we did lose 199 babies to a sleep-related death. Every single child had something else in their sleep area. The issue here is that, we talk a lot about surface sharing. And in many cultures, we don't take into consideration the cultural differences in sleep patterns and the way that we raise children, but also how do we ensure that babies are placed safely and the families have all the supports that they have necessary to practice the ABCs of safe sleep. More than half of the deaths that were sleep-related deaths were to black families, and also most of them were in the city of Cleveland. And so what we're doing here right now is talking about why, right? So we can point fingers and place blame, but why is this really happening? And my favorite model is that social ecological model. And so, it's so easy for us to rely on the healthcare system as the folks that are having the solution. They are an integral part to our health and well-being. But 30% of our health is what we choose to do, right? And so our choices are based off of the environments that we're in. And so a physician can provide any slew of recommendations, but if you don't have the necessary supports in place to support healthy choices and healthy behaviors, you're honestly at a disadvantage. And a different way to look at it is talking about the impact of racism and discrimination on these larger social contexts, right? I'll give an example of, we always talk about the redlining. Back in the day, in the 20s, when the banks were redlining communities, this was strictly based off of racist ideology. Communities that had persons of color or that were non-white in them were basically labeled like C's and D's, which limited their access to funds to provide for housing, for repairs, for maintenance, and things like that. So what that did was cause this white flight, right? So if you lived in a community with black folks and they decided the housing values were low, folks decided to move out because they wanted to have, be in a community that was deemed of higher value. But what that also contributed to was the consistent disinvestment in all these other structures. So we're talking about how the taxes are funding the schools, the police and fire safety measures, the quality of the housing, grocery stores. That is a racist policy that is having downstream impacts on families. And so when we have these assumptions about what the solutions are, we tend to not really talk about why they exist the way that they do. And so when we take a look at what Cuyahoga County is looking like, we do have some phenomenal resources here, right? We've got this robust healthcare system, really world-renowned. We have a lot of the evidence-based practices happening. We're providing nutrition support and safe sleep education. Of course, we've got First Year Cleveland, supporting doulas, but the issue is our liabilities. So we can have all these interventions. We could do all this work on the ground, but if we don't fix our liabilities, which is that upstream work, none of that's going to matter, right? So, having unstable or unsafe housing and living in a food desert, not having access to quality transportation, livable wages, the school systems that are not performing well, how are we going to move the needle? And so even when you look at it on here's a map of Cuyahoga County. So this is Richard Stacklin from the Board of Health put this together. He developed this Social Determinants of Health Index. And basically, the communities with the highest liabilities, meaning the lowest amount of resources as it applies to education, transportation, economic stability, housing, are those that are in the darkest red. Those are also the same communities that were redlined in the 20s. And there's a C, right? It kind of does a C. So it's primarily the city of Cleveland and the first ring on the east side. Those communities are also, in addition to having extremely high infant mortality, have the highest rates of chronic disease, crime, cancer. It just goes on and on and on. And so it's these communities that have been disinvested in the lack of resources that are creating the biggest issue for us when we're trying to support families. And so our response is to do a both and. If you've ever seen this whole upstream, downstream strategy, it's like, if you see this river and there's all these babies in the river, and let's go grab a baby. I'm gonna save all these babies. Until one day you're thinking, where are these babies coming from? Why are the babies in the river? And so our job at First Year Cleveland is to not only pull these babies out, or families up, but address the upstream impact, the upstream cause of why it's happening. It's one thing to provide safe sleep education and give someone a pack and play. But it's another thing to advocate for paid leave, so now mom can stay home for those 3 months and have higher breastfeeding rates, and she's more likely to be less tired, right? So when it's able for her to practice safe sleep. If we think about, even with the home visiting programs, it's so important that we provide support to families, right, through all these resource linkages. But why do people need resource linkages? So what are we doing to ensure that our families have quality jobs, all the things that I've already talked about? So First Year Cleveland is doing this a both and approach as an intentional way to being responsive. So as Dexter mentioned earlier, we were formed in 2015 in response to this super high infant mortality in 2015. And, our goal is really focused on Black infant mortality, not because white babies don't matter or Hispanic babies and Asian babies don't matter, but because if we don't do anything about what's happening to our Black babies, no one's gonna thrive. It's so important to have this equity lens to invest your resources where the highest need is, if we're going to move the needle at all. And we're rooted in equity, justice, transparency, accountability, collaboration, of course, and inclusion. And over the past, 8 years, this is kind of like a summary of our shift and how we got to the Mandel School, which I'm super excited about. I was a part of the original think tank that created First Year Cleveland back in 2015. And, I was excited when First Year Cleveland came to Case just because of the resources, but I also knew, because I love my social ecological model, that being at the School of Medicine was a fit, but was it the best fit? Like, how are we gonna start talking about these social context pieces? And so here we're excited to have an advisory task force that's been instrumental in us also releasing some funds to faculty to support our community partners. So these are just added value to having First Year Cleveland here. And so our commitments are not only to raise awareness about the inequities, but to engage and invest in communities, while advocating for policies and systems changes that address racism and the social determinants of health. Because the thought is, if we can bring healthcare together, our political leaders, our families, our community organizations, and we keep Black women at the center of the work, we've got to make a change. There's so many times where folks come out of their offices and think they have the solution, but we don't ask people what they need. We don't ask them what they want. We just decide that this is what I'm going to do. And First Year Cleveland is not doing that. We are going to be very intentional about having conversations with people with lived experience, conversations with people that work with the community, and being that supportive entity to help not only our community organizations, but pregnant women overall. And so some of our examples of our upstream and downstream work, we did in the past help to pass House Bill 11 that basically made sure that there was going to be funding for evidence-based practices in maternal and child health. That included the doulas centering pregnancy and all the home visiting. And we also trained a number of healthcare providers with Racial Equity Institute training. Currently, right now, we are working with an organization called Neighborhood Leadership Institute, leading our One Community effort. So that's a resident-led collective impact model where we can make sure that by zip code, we have community-based solutions. The downstream work, which is equally as important, providing services to Black women. So our wellness network is a network of Black mental health providers for Black women, in addition to having a pregnancy and infant loss group. And of course, we're increasing capacity of those evidence-based interventions, and we fund currently 10 different organizations across the spectrum. And so I challenge you all, what can you do? Because folks say, well, what can I do? Who am I? It's really about having these conversations, about shifting the narrative from personal responsibility to systems accountability. Racism is the reason, race is not. There is no biological difference between Black women and white women, but there is definitely a difference between the experience of a Black woman and a white woman, not only in Cuyahoga County, but in this country. We're going to be launching some committees. We'll have a policy committee and a community-based advisory board. You're more than welcome to take part in that, and also some listening sessions. I ask and I plead with you to support any type of legislation that addresses equity, and do not support legislation or policies that impact human, civil, reproductive rights. That is going to hurt everyone. And it also is very important that we prioritize inclusiveness from the beginning of the community in all of the work that we do. And so here's a list of some of our partners. This is some, we've got tons, but the ones highlighted in red are those that do receive funding from us. We do not turn anyone away. If you care about saving some babies or fighting for justice, First Year Cleveland can find a way to support and work with you. And I'll give you some upcoming events. So we're hosting a toxic screening, Toxic a Black Woman's Experience, next Wednesday right here. And we got Mitchell's Ice Cream if you're interested in coming. And it's a very short film produced by First Year Cleveland that basically showcases what it's like, a day in the life of a woman of color, and it was shot right here in the city of Cleveland. We're having a partner meeting on the 27th. You're all more welcome to come, and I'll keep you posted on our listening sessions. So with that, do you have any questions? No? It's all quiet. Questions, comments? What are your thoughts? Yes, we have a microphone. Feel free to walk on up. That's okay. Well, no questions. That means I covered everything. So, hello. I just want to see how much time, because I don't want to. Oh, sorry, no problem with doing it. Okay.
Thank you, Angela. This is it's phenomenal to hear you talk about this really important work, and you're hitting First Year Cleveland really in what we hope is a rebirth of the innovation and energy that was represented in its initial launch. I wanted to ask about the reality that we have been working this issue. We could talk about what date, but maybe in the 90s when federal funding began to flow through Healthy Family, Healthy Start, focused on home visiting, and we have quite a deep infrastructure. And then on your list that you showed, and I've seen this repeatedly, we have standout new organizations like Birthing Beautiful Communities, Village of Healing, who are showing phenomenal results.
Yes.
And the thing that's similar about them at one level is they are Black-led.
Yes.
And I just wonder how we have to at some point realize that the system is so ingrained with some of these issues, we need to engage new partners and fund them sufficiently to get to scale.
Absolutely.
So some people are going to feel that as a threat, some institutional partners who have benefited from the current system in terms of funding. And I just wonder how you walk that line with, can we expand the pie here? Can we expand the pie and fully fund these new initiatives that are getting the kind of results that we have to have?
That's a very good question, and I'll try to be politically correct in my response. So yeah, it's extremely important to acknowledge the impact that our new Black-led, women-led organizations are having in the community. With the for us, by us, with us mentality, I think that it's changing the game. It's changing the face of healthcare. It's changing how we are traditionally how we're doing business. I was a part of the original Medicaid application that actually funded Birthing Beautiful initially. And I, at that point, had to fight to get them included in this application because this fear of, well, we're doing this, we don't want to add, who is, at the time her name was Kristen Farmer, who is Kristen? Where did she come from? And there is a real fear from folks to not want to share the pie. But when we got over that fear, right, like, wait a minute, this is like an amazing concept. Black community doulas trained to advocate in the medical room during labor and delivery. Nobody's doing that. Look at what they've been able to accomplish, right? So Birthing Beautiful Communities has started off as a doula project that's really providing these wraparound services. And the way that they even employ their staff, they have an unlimited PTO. They're doing things much different than our traditional models are. And I think that there's so much value in that, along with Village of Healing and Pregnant with Possibilities. We have to invest more in Black organizations, period. And not take away from what has worked, but kind of pressure the existing structures to be flexible and evolve with the time. Because you can't do the same, that's the definition of insanity, right? Over and over. And I too have been in this work for 20 years and we still have the same problem. And some of the programs are still operating the same way they were 20 years ago. And so it just speaks to evolution. We have to do better, be more inclusive. And I'm all for it. So we will be and have been in funding Black community organizations, and I intend to, with the additional funding that we do secure, to continue that investment. We're hopeful that Village of Healing to have a Black women-ran reproductive health, women's health center Like, they quit their jobs and was like, we're going to do it ourselves. And that is not only commendable, but it's outrageous. It's phenomenal. And their outcomes are impeccable. And so it's just proof, right? So sometimes you just got to prove people wrong. And that's what they're doing. Like, so I'm excited to actually be able to partner with them and Pregnant with Possibilities as well. And anybody else that's out there that wants to partner with us, you know. So, yes. Any other questions?
So, Bexel was in the Mandel School.
Yes. We know.
So, Angela, thank you so much for that very powerful call to action presentation. So you and I have had conversations many times about this, and you've always reminded us that 80% of the outcome for Black mothers is part of the social determinants of health, and the other 20% is interaction with the medical care setting. Can you share with us, give us some insight into the fact that Black women, irregardless of socioeconomic status, have similar outcomes to their lower income Black counterparts? So I think about someone like Serena Williams, who's certainly not living in a resource-strapped community, but almost lost her life and that of her baby. So could you talk a little bit about some of the dynamics related to that? And, you know, I think that further sort of underpins some statistics by the Institute of Medicine that indicates that a white woman with a high school diploma has better health outcomes than a Black woman with a PhD.
Yes, yes, this is all very true. I tend to, when we talk about the social determinants of health, it's easier for folks to kind of understand and contextualize the impact of racism with using, you know, the redlining as an example for the kind of setup. But there has not been a consistent way to measure stress associated with being Black. Toxic stress, which is why we put together the Toxic documentary, which highlights a woman with a PhD and her experience. The microaggressions and the, I don't want to, see, you got me there. And raising children, Black children, being a mother, is not the same. I think that this, having to go through life as a Black mother, a person, to where you're always being questioned, you're always, you know, suspected to have, you know, to be a threat, to always having to prove yourself is stressful. How did you get here? How did you get this job? How did you, you know, can I touch your hair? Can I this, can I mean, when I was pregnant with my son, the doctor asked me if I knew anything about my baby's daddy. Okay, I planned my pregnancy and it's my husband. My son was almost expelled from kindergarten, right? This is a little boy that's deemed aggressive. I just, sorry, I could, it threw me off, okay. The experience of being a person of color in this country is like no other. It's not that easy. You could talk about this whole pulling yourself up from your bootstraps. You could talk about the folks that made it out. But why does it have to be that hard? Why? Why can't a child with dark, beautiful brown skin have the same opportunity as a child with white skin? Have the teacher not look at them differently while they're in the classroom? Have the job offer that they are qualified for be approved for that home loan in the neighborhood that they want to live in? These are the things that impact your day-to-day life, and we don't talk about the stress because we don't understand it as stress, because if this is your life every day, it's normal. That's just the way life is. Birthing Beautiful Communities did a study taking hair samples of pregnant women who said they weren't stressed, but the cortisol levels in their hair was through the roof because we don't acknowledge the stress, right? Because this is how life is. So, but to someone that maybe doesn't have that same day-to-day experience, you know, you wouldn't, how are you going to get to work today? How are we going to pay the bill? How are we going to do whatever, you know, or you lost your job? You got expelled from school today for, what did my son do? He tapped someone on the leg. And they said that he sexually, literally touched a child, and he was 5. What I would love to do is provide a perspective transformation, right? Can we change our perspective on what the experiences are like to have more empathy and humility for people of color? I'm a biracial woman. My experience is not that of a black woman nor a white woman, but I am raising a black child. And now more than ever do I understand what it's like. I had an idea before because I wasn't white and I wasn't black, but I was something. But now that I know because of my son, we have to do better. And when we start thinking about the decisions that we make and who benefits, that's when I think the narrative will shift, right? We have to stop being so selfish. If it doesn't affect me, it doesn't, but it does. And so I'm hoping that First Year Cleveland is able to not only educate people about infant mortality, but talk about how these larger systems are causing these problems. It's ingrained in us, right? We're raised to believe. I mean, this colorism is real. How do we undo that? One day at a time, because it was created over 400 years, probably before that, you know. So, yes, black women with a PhD are more likely to lose their baby because life is not that easy, even with a PhD. Thanks. Any other questions that are not sensitive?
I'll ask you in sensitive.
Okay.
Hi, Angela. I'm Amy Korsh-Williams, Center on Trauma and Diversity. Thank you for the work that you're doing and for your powerful testimony. I've been reading a little bit about expanded Medicaid coverage for doulas, and I wondered if you could speak a little bit about where that legislation is. And I was also curious as to what you see as sort of the primary focus area in moving the needle. Like if you had to pick one element of the work that's being done, what do you see as the biggest part?
Okay. Well, we were really close to getting the legislation passed for doulas. It died, but it's being reintroduced, so we're looking for some champions to kind of push it over the line. I think there was some interesting testimony that, you know, I don't even want to talk about it because it's insane, but one person made a comment that they kind of voted, they did not support it or didn't get approved. There is still time before the governor's budget gets approved by July. And so we have testified and we will continue to provide testimony in every opportunity we have for that. With regards to making a difference, I mean, I think that one of a game changer, which most other countries provide, is paid leave. So families that have paid leave, at least I'm talking 12 weeks. Now, some countries a year, like, you know, go to Canada and be there for like a year. Being able to go to the doctor, I mean, hello, like, and not have to worry about losing pay or having the security of keeping your job just so you can care for your child, I think would be a game changer. And that's for all employees, not just full-time people that have been here for a year or something like that, but you should be guaranteed a minimum of 12 weeks paid leave for both mother and father. I think that that could be one of the most impactful policy changes that we could do that would, you know, kind of level the playing field, at least when it comes to taking care of yourself and trying to take care of your infant. The other piece I think that's equally as important is some accountability measures in the healthcare system as it relates to racism and social justice. So when we talked, you know, when Dexter mentioned about Serena Williams, you know, it doesn't matter how much money you have if the doctor does not want, you know, they're going to treat you differently. They're going to treat, you're kind of subjected to whatever happens. And I would love to see some clear accountability measures in our healthcare systems that would ensure that there is specific anti-Black racism strategies being put in place. I want to thank you all for your time. I hope I didn't make you sad, but I hope I made you think about something a little bit different. You know, everybody wants to have a healthy, thriving child. And so our job is to figure out how to make sure that that's possible and it actually happens. So with that, thank you. We are located on the third floor.